Hello again. I am delighted to be hosting you on this lecture on how doctors investigate hepatitis B. It is not rocket science what we do as physicians when patients come with a diagnosis of hepatitis B. I will take through four aspects to this lecture. We'll look at the investigations that are done that are related to the hepatitis B virus itself. The second part will be those investigations related to the state of damage to the liver. The third one would be tests for other infections that may either complicate or make the treatment of hepatitis B a bit challenging. The last but not the least would be investigations to assist in staging the degree of liver damage and possibly to even guide whether treatment is required or not at the point, at least at the time of diagnosis. So let's look at those investigations related to the hepatitis B. Many of you would have heard about the combo test, which is what is known by in many countries. But what that means in medical terminology is called serology. This is a tiny blood sample that is put inside certain investigative tubes, and they're actually able to characterize the antibodies as well as antigens. There are 5 of them in total, but hepatitis B surface antigen, hepatitis B E antigen, and anti-hepatitis B E antibody, the anti-HBs antibody, and anti-HBC antibody. Note here that there is no hepatitis B C antigen because that is not soluble in blood, and so if you see someone with a blood test that tells you it's a negative hepatitis B antigen, then they must have been doing something wrong. Hepatitis B viral DNA is what is commonly called viral load, and that is what can be done. And also in rare cases, the genotypes are done. This is particular if there are cases of resistance to treatment. The second category of investigations are those done relative to the state of the liver. A full blood count is done because if the patient is sick and unwell, then they will have anemia because they're not eating well. The platelet count will be low. That is one of the blood cells responsible for clotting. And the second category of test would be liver function test, which is bilirubin and some enzymes of the liver. Of course, the way the liver damages the body is through damaging the liver. Coagulation is also important. This is looking at the clotting factors so that when the virus attacks the liver and is damaging the liver, then it could make the way the blood clots when somebody is injured would be impaired. But this is not in all cases, and for which reason these tests are done to categorize the state of the liver and how it's functioning. The third category of tests are tests for other infections. HIV complicates hepatitis B in the sense that it makes the treatment challenging, and those who have HIV then have reactivation of hepatitis B as well. And so it's important to screen that. And there are some medications that can work for both HIV and hepatitis B. And so when you're making a choice of treatment, you then need to know whether somebody is co-infected or not. Hepatitis C also is important as also another cause of hepatitis that can actually make the prognosis very poor for hepatitis B. And so screening for it would be vital in terms of making decisions for treatment. The screening for liver cancer is also very vital using an ultrasound or a blood test known as alpha-fetoprotein. It may alarm you to know that at diagnosis of hepatitis B, some people already have liver cancer. And that is the reason why an ultrasound would be significant at the time of diagnosis before treatment is commenced. It is important to ensure that your overall health is evaluated before your treatment is started. The last group of investigations are those to assist in staging the degree of liver damage. Nowadays, fibroscan, which is a measure of stiffness of the liver, can be done within 15 minutes of going to clinic. In resource-limited settings, however, there is a test known as APRI, which is a combination of clinical parameters and blood test, and which is actually been tagged poor man's liver biopsy. It can actually give an idea of the stiffness of the liver without the need for a liver biopsy. In rare cases, liver biopsy is indicated, and this is major, particularly important if it's going to affect the management of the disease or the uncertainties about what has been detected on the ultrasound or any other imaging of the liver the patient may have had. Thank you again for being part of this, and I hope you will continue to stick on till the end of this course. Bye-bye.